surgery, this would have spilled into the chest. If I did not know in my mind that it was going to be ruptured, be it the right or the left, the silicone would have spilled into the chest. If I had not done an end block properly, this would have spilled into the chest. So the surgeon has to go into the case thinking that both the implants are ruptured, or they might be floated around, or there might be badness on the inside, because you never know what you're going to find till you go inside and cut the capsule open. You do not want to be doing it on our local like you heard yesterday, and you want to do it with the right etiquette such that you are going millimeter by millimeter. Literally, I would say, if I take my sterile marker, it's literally going millimeter by millimeter and removing the capsule off of the rib. This was a very tough case. It was a lot harder than what I expected. And if you have to dissect like this very slowly and tease it off, this surgery is not about speed. I see a lot of surgeons doing a supposed end block and a lift and a fat grafting in 2.5 hours. That's virtually impossible. No matter how thin the capsule is, it has to be removed in this fashion. And the total capsulectomy and end block is the gold standard. Remember, that is the ultimate. 1,000%, no one can deny this, that why did you do an end block? And as you can see, all of this was contained. Now the other thing I want to mention here is this was the year in 07 when the implants were introduced as safe, as good as the gummy bear. Look, it disintegrated. And you can see, look how thin this is. You can see my glove. Look at my glove. This is how thin this capsular tissue is. No matter how thin, it is removed in the fashion. And you know, to all those plastic surgeons who say these are still gummy bear, there is nothing gummy about this. There's something certainly gummy about it, but you can see it's starting to turn yellow. And if you ask me, for my gut sixth sense, this was on its way to rupturing as well because it's old. So as you can see, all of this is contained. Look at the shell of this implant right here. If I press, that's basically falling out. And you can see this is going to creep into the tissues on the side, and none of this happened. So the word gummy is the wrong term to use in this one, because there's nothing gummy about it. So the implants are not lifetime devices. They certainly need to be monitored. She was scheduled to supposed to be getting her MRI, but she chose not to. And again, this is a very important point to make, that according to the manufacturers, if you look at Mentor, they tell you to get an MRI at year 3, and then every 2 years they're onward. So in her, I'm going to summarize what is the con procedure. She's not going to get a lift. Too inflamed, great for contracture, a lot of inflammation. Plus, she very likely she will not need a lift. No need for drains. The capsules will be going to pathology to rule out that very rare BIAL, CL, CD30 analysis, rule out lymphoma, rule out malignancy, cultures for Arabic, anaerobic, and fungal. The implants will be returned to the patient, twilight deep sedation, and she's going to get the high definition pictures and videos of not only this Facebook Live, which she's going to see on the YouTube Live, but more importantly is the chest wall. So this is the take-home message. Show me the chest wall. That's what every patient must ask their surgeon. Show me the chest wall, high definition pictures and videos, because that's the ultimate proof. And that we will see how she's going to do, and you can only imagine how much better she's going to be minus these toxins. There you have it. This is Dr. Khan, Executive Plastic Surgeon.